Hi again, Dr. Walker from DentalWalker.com. Welcome back to the channel. And again, before we get too far in this video, give me some likes, some thumbs up so I can continue doing this work that I'm doing. Anyway, talk a little about B12 and B12 disorders and some of the problems you can face when you have a B12 deficiency. So before I get too far again, the thing I need to remind folks about is to just double check your multivitamin, your vitamin B complex, or if you're taking just a vitamin B supplement by itself, just look at the back of that bottle and confirm that you're not taking the version called Cyanocobalamin, Cyanocobalamin. And the reason I say that is, A, it's the synthetic version of B12, and B, there are a few people, not a few people, about half the population I mentioned before, who are unable to convert the Cyanocobalamin or the synthetic version of the B12 into the active usable form. And you don't know that, right? And you're walking around most of your life sort of in a fog, lack of focus, perhaps sleeping disorder, things like that, and you don't fully understand why. Or you might have had a child or two in the past where you end up having some complications with pregnancy. You may end up with blood pressure issues or diabetes issues while you're pregnant. And because they give you, in that time, they give you the synthetic version of several things, to include folic acid, for example, and they give you cyanocobalamin. Again, and if you are unable to process and break down that cyanocobalamin into the usable form, then it ends up building up in your system and can at some point become toxic. And so now a lot of the quote experts will quote tell you that your body or your liver is able to process a little bit of cyanide. And again, that breaks down, cyanocobalamin breaks down into cyanide and cobalamin, the B12. But they'll tell you it's just a little bit, and it's okay because your liver can process a little bit of cyanide, and that's probably true if you do not have underlying liver disorder, one, and two, that's also true if you're not taking the cyanocobalamin in other versions, other things, to include a lot of energy drinks will have them, fortified foods will have a lot of them, right? So taking a little bit of this quote cyanocobalamin a lot or many times over the day, over the week, over the months, over the years, you end up having problems. And it's problems you can actually prevent by using the active, natural, non-synthetic version of the B12, right? And I say a lot to say that it's not the natural version. Cyanocobalamin is not the natural version. There is an active version that you can use, Methylcobalamin or Cobalamin. Those two you can use, and the preferred one, the one I use, is the Methylcobalamin. Now, if you use that, just again double check your B complex, double check your multivitamins, and really your fortified foods. Really, all of those foods have the synthetic version, if they do have the B12 in it, the synthetic version of the B12. So I would say do not take that version, because again, you can end up having some problems, or it may not even work for you because of an underlying genetic disorder that you might have, MTHFR Gene Disorder you might have. And that's a long word, I get that. But if you have that disorder and you're using the B12 that is the synthetic version, the cyanocobalamin, then you could run into some problems, right? Or you can stay clear of that whole thing and use the natural method, the natural version, which is the Methylcobalamin. Okay, so some problems that you can have. Number one, poor sleeping disorder, poor mentation, eyesight disorder. Sometimes you might have peripheral nerve issue, numbness, tingling, that sort of stuff. Or you can even have late term. You can even have balance disorders. Would be another complication. Balance disorders would be one. And again, numbness, tingling that you can have, lack of sleep or poor sleep quality that you might have. And you can end up even having anemia, right? You can have an anemia because your B12 levels are abnormally low, right? So all of those things you can have. But the biggest one is just people who wake up in the morning and they just can't seem to get going. They can't seem to get things going, get things moving. It might be, and it could be, a B12 deficiency. And if you're taking the wrong B12, again, as I said before, you would never know, right? Because you think taking this B12, you think it should energize you, and it does. Actually, one of the things I do every single day to get a little extra energy level going is to take that my methylcobalamin. And that works well for me. I take 2,000 milligrams, and again, it's a water-soluble vitamin, which means it's a water-soluble vitamin, which means it doesn't really get a buildup. That one doesn't get a buildup in your system, causes some problems. But 1 to 2,000 milligrams, you can certainly take. And I'll put a link in showing you what other people sort of suggest in terms of the higher or upper limits of the B12 that you can actually take. But yeah, people who have problems, for example, get going in the morning with mentation and focus and concentration, right? Peripheral nerve disorders, numbness, tingliness, all of those things may be signs of B12 deficiency. And for me, there are tests you can take to confirm that you have the MTHFR gene disorder, or the simple thing would be, and that's like $600, $700 thereabouts, or you can simply bypass that test, bypass the synthetic version, and take the natural version of the B12, the methylcobalamin. Thanks for listening, Dr. Walker.